Hey guys, Sherry here instead of Colton and Kylie for you to spice it up. I bet you'll never guess. I'm here to talk about pediatrics. Okay, couple things. Instead of doing the big skill station, there are just a few things you need to be aware about pediatrics. One of the biggest ones, especially for our trauma trained people, is that we do not use, and I'm going to say that again, we do not use the medication doses on our Braslow tapes. They have been actually found to be incorrect. On top of your crash cart is this fantastic book that is actually essentially all of that you would need. It is the Pediatric Emergency Drug Book. It has weights on it. It has all the things that you could possibly need. So this is what you're going to want to grab if you are looking for emergency drug dosages. There's also a little ET tube sizes right there. This is meant to be a full resource for you, okay? So again, no Braslow medication dosages. Refer to your drug card here. It's fantastic. The second thing we want to talk to you about is, did you know that we actually have draw value limits on pediatric patients? And when I say that, I mean blood draw limits. There's actually this chart that's been down in BPOD that I've been aware of because I sit next to Fleb all the time, but it actually talks about our limits on it. We do not often have babies who are only 2 kilos here, so it is a big deal. Like in our NICU, they actually choose to delay any sort of labs until something is wrong, but we're the ER, so things are always wrong. So we actually do have limits. So what we are asking is that you be conscious of how much blood you are taking from our pediatric patients. When in doubt, always use our PEDs tubes, okay? We have little pediatric tubes. Anything under even 4 years of age, these are totally valid for the number of mLs that you need to run a test. Okay, we actually, and you'll notice, these are gold and blue tops. We have them available for it, but these will help you keep your volume small, because if you put up a normal tube into a vacutainer, it just starts to fill and you might not pay attention. So when in doubt, use a syringe. We carry the 1 ml, so you can be sure that you're only pulling an ml, or use a 3 ml syringe and maybe be more cautious of how much you're taking off. Now, to give you context, the test that requires the most amount of blood is an ESR, and it needs 1.5 mLs, okay? A blood culture needs 1 ml in 1 bottle. CMP only needs 0.6 mLs. And the CBC actually in these lavender ones, sorry, running fast, where'd it go? Of course, all I can find are green. Lavender ones, it just needs to be between those 2 lines. There's, if you could even possibly see, it's okay. There's 2 lines on here. It just needs to be between that, and that's enough, okay? So just keep in mind, you do not need to do lots of blood. And especially in our pediatric population, wait until you find out what tests you need so that we are not overdrawing on them. It is something to be conscious of, okay? Fantastic. IV boxes, remember just a little spiel here. If you use it, refill it. Okay, that was my PSA there. All right, now, I also want you guys to be aware. I know you know this, but sometimes we forget. If you get, and I'm actually guilty of this, but if you get a baby, meaning anybody under 12 months of age, you need to have a documented head circumference. We do have these, especially out in triage. You can run out and get them. They're designed to thread through so that you can pull it tight around their little head. And actually, best practice would be to do 2 measurements and then make sure that you can either average that or make sure you're within it. Now, what are we doing this for? Why do we care? It's actually part of our pediatric abuse screening, which leads to the next issue we need to talk about. There was an email sent out by Jen on Thursday, the 12th, I believe, and it talks about you need to do your pediatric abuse screening, and if it is positive, you will need to document a huddle, okay? So please pay attention to that, read your email. The other thing I'd like you to know is that my goal is to always have us be the best pediatric care, that it's definitive here, and that's why we do these things. Good luck.